Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Going to Capitol Hill, going to your state legislators and just telling them your stories is such a big deal. And when we say amplifying patient voices, that's what we mean. And when we talk about amplifying Black patient voices and their experiences, it's the exact same thing. Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today, we're going to talk about Black History Month, its importance, some research updates, and how we can amplify Black patient perspectives.
But first, we do have a few news updates. Steven, I think the most exciting update is this Amicus Brief that you worked on. Can you tell me and our listeners about it?
GHLF, along with 28 other groups, have asked a U.S. District Court to accept our Amicus Brief in a litigation concerning a 2021 federal rule. The rule essentially says that health insurers do not have to count the value of drug copay assistance programs towards patient out-of-pocket obligations. This is a big deal. This is something that we have been fighting for many years, the idea of using copay assistance programs and having it count towards out-of-pocket cost obligations. If our Amicus Brief is accepted, it will help the court understand how copay accumulators negatively impact patients, caregivers, and healthcare providers. If we're successful, it will allow for patients to continue to use copay assistance programs and count them towards out-of-pocket cost obligations.
This is a really big deal to help patients because often these copays really add up, and if it's not counting towards the deductible, it just becomes like a big financial burden over the course of the year. Steven, I'm wondering though, what exactly is an amicus brief?
Good question. So typically, civil litigation is only between two parties, a plaintiff and a defendant. In this particular case, the litigation was brought by several patients, along with some patient organizations that represent those patients. However, in some cases, the outcome of the litigation has the potential to impact people other than the two parties litigating, the plaintiff and defendant. For such cases, you look to file what's called an amicus curiae, which is Latin for a friend of the court, and we are looking to enter as an amicus, or friend of the court, to provide the court with relevant perspectives, information, and arguments that show the court how a particular ruling could affect non-litigating parties. In this case, how it will affect patients. Is that helpful?
Yeah, that's really helpful. It's ultimately raising the voice of patients within these conversations and saying, this is affecting a large group of us.
Absolutely. It's kind of like how we advocate in the legislative branch of government, the first branch of government. We go to legislators and seek to educate them on the patient perspective and what patients are dealing with in terms of accessing their needed therapies. This is essentially like advocating to the judicial branch or specifically to a particular court.
Great. Well, I'm excited to see what happens here, and I hope that the court is on our side and understands, the need for patients to have copay assistance and it counting towards their deductible.
Definitely. So we'll see how that goes. In other news, the Food and Drug Administration finalized a 2020 draft guidance detailing the agency's recommendations for clinical research for developing cannabis and cannabis-derived human drugs.
So this guidance really impacts research and ultimately at the end of the day, patients in our community. So it says that, those involved in the clinical research of cannabis can rely on this FDA guidance for a few things: recommended sources of cannabis for clinical research, resources for information on quality and control status, and also how to calculate THC differences. So just a bunch of technical things to help improve the quality of research around cannabis.
This is great news for our community. We're always looking for any kinds of way we can get help with therapies to make life more bearable. And if there's something that can be found from hemp or cannabis, that's going to, clearly make a difference in the lives of our patients. I'm curious if this is something that we've spoken with our patients about and any feedback we've received.
Actually, it's interesting you bring that up, what the patient perspective is, because in 2019, we did a survey of our community with rheumatic diseases, and we found that over half had tried medicinal cannabis at least once. and most commonly for pain. Actually, 96% said that they did it for pain. Further, like whether or not they had used it, 66% said they wanted more information about it, and over half said they preferred to have that information come from their physician. So I think when we look at this final guidance from the FDA, it will help get some research that patients can talk about with their doctors and sort of legitimize this space.
Yeah, well, it seems sort of axiomatic that any more information on the use of cannabis and how it might be helpful will certainly be a good thing.
Great. Okay, well, our last piece of news, New York State ends the mask mandate in healthcare facilities.
As of our recording, actually, this means that healthcare settings, hospitals, and nursing homes are essentially setting their own masking rules individually.
So, this is in line with what happened federally. Back in September, the CDC removed the federal mandate requiring masks in healthcare facilities. And I tried to look up what other states are doing, and it was actually really hard to find data. It was all websites that haven't been updated in some time. So,
Huh.
it's not clear if other states, if their healthcare facilities are still masking. And I guess it's sort of you have to be local and be going there to find out what's happening, which is a little concerning that that information isn't more available.
I wonder if it's a county by county thing in some states. I truly don't know. I do know that I am selfishly very concerned about this. The idea of having to go to a hospital and not knowing what the masking rules are is concerning. The idea of going to a hospital if you're immunocompromised, if you're elderly, is a scary thing. Hospital-acquired infections are a real thing. I would think pre-COVID, the idea of wearing a mask is something that should have been explored. But in a post-COVID world where hundreds of people are still dying on a daily basis, and in a facility where, let's be honest, there's a lot of sick people in that facility.
In a hospital?
Yeah,
What? No way.
you would you would think that they would want to keep the spread of all diseases to a minimum. So it's concerning. I just think of a scenario where an elderly relative has to go in for surgery. If you're not wealthy, you have to share a room during recovery. So you share a room and you're sharing a room with somebody who doesn't want a mask and who knows what they're in there for. And they bring in their relatives during visiting hours and those relatives aren't masked and other relatives down the hall are not masked, so on and so on and so on and so on. And meanwhile, this elderly individual who just came in for surgery is now being exposed potentially to harmful viruses.
Yeah, I mean, also for just our community with chronic disease who often uses healthcare facilities just for routine care. I know some of my doctors, their
Yeah.
offices are in the hospital, so I do have to go through the hospital in order to see them. And I just wonder how many people are going to forego their regular chronic disease care because they don't want to be put at risk and just end up in a worse health situation overall.
I always felt like the rules, the mandates from the state or from the government at least gave the imprimatur for the local institution to say, hey, it's not our policy. It's kind of like the no dogs in restaurants policy. Like, oh, I'm a restaurant owner. I love dogs. I would love to have your dog in my restaurant. But, it's not me. It's the health department. But without that excuse, it's going to make it more difficult for hospitals to implement their own rules, I think.
I agree. Well, for now, though, I think New York City announced that masks will still be worn in their public hospital system.
Yes.
So we will see how that holds up.
And the private hospitals in New York City and upstate New York have said that, TBD, to be determined. We'll see what they decide to do.
All right, so let's jump into our big topic of today. It's Black History Month, which is a time to just celebrate the great achievements and commemorate important Black heroes and events throughout our history. But also, as people in public health and the healthcare world, it's a time to reflect and raise awareness of racial and ethnic disparities across these health sectors and, what we can do to help change that.
There's always more work to be done in this space, and GHLF continues to honor, amplify, and uplift the experiences of those living with chronic illness in the Black community. You could check out a portion of our work at ghlf.org/Black-History-Month for patient stories and to learn more about health disparities. And we'll put this in our show notes as well.
So, health disparities, let's talk about that for a minute. First, I just want to say why I talk about health disparities. It's important because, recognizing them helps create change. We're not going to create change if we're not talking about them. And we need to keep highlighting what's going on in different communities, say that it isn't people's fault. There's inequities in our system that lead to these health consequences. And, there are actions we can take, but we can't blame the individual. It's on us as a public health community to recognize and take action on these.
We talk about health disparities. It's a sad state that depending on where you live, your zip code can determine your life expectancy. And there's a range of almost a decade difference of life expectancy from some of our longest living zip codes to some of our lowest life expectancy zip codes. According to the CDC, nearly half of all African American adults have some form of cardiovascular disease and stroke. About 2 out of every 5 African American adults have high blood pressure, and less than half of them have it under control. And when it comes to breast cancer, Black women have the highest death rates of all racial and ethnic groups and are 40% more likely to die of breast cancer than white women.
The heart-wrenching part is that this list can go on and on. That's just a few of the many health disparities that exist in our healthcare system, especially for our Black friends. And it's important to talk about this and let people know that, these exist and we need to do something about it. I actually saw this recent study that suggested that racism might contribute to inflammation. I know we already know that racism and discrimination impact many aspects of life, but this recent study looked at how racism and discrimination might disrupt what they call the brain gut microbiome system. They did some MRIs and also some blood tests and microbiome analyses. And at the end of the day, what they found is that the blood tests revealed that Black participants in the high discrimination group had high levels of this enzyme that leads to inflammation, and Hispanic participants did as well. And the microbiome analysis revealed that they had high levels of bacteria in the Black individuals in the study, and this was for people who face high levels of discrimination. So ultimately, what this meant is that bodies are showing that high levels of discrimination lead to higher levels of inflammatory enzymes, proteins, things in the microbiome that cause inflammation.
Is there a theory that higher levels of stress were causing this enzyme to form, or was it something that is in the genetic code of individuals with certain backgrounds?
I think it was the first about stress because they broke them down by discrimination groups. And I think, discrimination isn't something you're born with, it's something you experience.
Oh, interesting, interesting. Did they break it down by socioeconomic status to try and hone in on that, or
I'd have to look back at that. I don't think so.
interesting?
I think it was like by white, Black, Hispanic, different races.
Interesting. Well, not surprising, unfortunately, but certainly interesting. And I'm sure that's one of just many, many studies that detail the health disparities in our system.
Yeah, and I hope that research like this just like shines a light on the injustices and helps people recognize that we need to take action and that these are legitimate things happening to people and altering the chemistry of their body because of discrimination. It's not okay.
Absolutely. Absolutely. So, what can we do as advocates to help on this front? As a start, amplifying Black patient voices and their experiences to help fight for equitable access to care is one place to start.
It's a coincidence. This week is Headache on the Hill, and this is an advocacy event that brings together health professionals, migraine and cluster headache patients, and caregivers, anyone really related to migraine and headache, to advocate and give asks of Congress to help improve access and funding towards these diseases. And actually, historically, there's been a really big lack of representation in the migraine community, and I want to give a shout out to our colleague Sarah Shaw, who's the senior manager of BIPOC patient outreach. She's changing that. She put together a group of BIPOC patients who are right now on the Hill sharing their stories to help affect change for others.
It's just like we always say, going to Capitol Hill, going to your state legislators and just telling them your stories is such a big deal. And when we say amplifying patient voices, that's what we mean. And when we talk about amplifying Black patient voices and their experiences, it's the exact same thing with a micro advocacy component to it. And it's great that Sarah's doing that. And it's great that she's brought together this group of patients who will be sharing their stories as well all week.
And really quickly, just, to end our show, I wanted to share a few quotes from the patients on this council and why they advocate. Leslie says, as a Black woman, representation matters in the migraine advocacy space and working to promote health equity is key. Tamisha says, I advocate because I know what it's like to suffer in silence and be misunderstood in regards to the wide array of migraine symptoms. Migraine is far beyond a headache, and migraine sufferers deserve more acknowledgement and consideration for their varied symptoms. Lastly, I'll share a quote from Desena, who says, "I also advocate because I believe our voices are worthy of being heard in a system that is constantly trying to push us off as someone not worthy of the care we deserve."
Very powerful. I would always remind listeners that advocacy comes not just in meeting with legislators, but also in one-on-one meetings you have with your healthcare providers. Be a strong advocate when you're talking to your doctor for your own healthcare.
Exactly. Find doctors that you feel comfortable with, that look like you. I know that's a really big deal in the Black community, is to be able to have someone that understands you on a deep level and just have that representation. It really matters. And I'm so excited that Sarah and this group are on the Hill this week advocating for things like that.
Absolutely. Absolutely. So we look forward to hearing back from Sarah and see what she's able to accomplish down there.
All right, Steven, that brings us to the close of our show. What did you learn today?
Well, I learned about the great interest in the GHLF community about the potential use for medical cannabis, and which just shows the importance of what the FDA is doing in trying to increase research in that field.
And I learned from you about what an amicus brief is and how it can help patients have better access to their care.
Well, we hope that you learned something too. And before we go, we want to give a shout out to the Asthma Podcast, an excellent new podcast. In the first few episodes, our hosts talk with the LGBTQ individuals on how they navigate their identities, relationships, and asthma all at the same time.
Definitely check it out at ghlf.org/listen. Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating and write a review on Apple Podcasts, and definitely check us out on YouTube as well. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.